any issue anyway, I will highlight that. And I now call on Ms Donlon to make your presentation, please. Thank you.
Great, thank you. I'd like to begin by thanking the Chair for inviting us here.
Sorry, 1 second. Yeah, okay.
Sorry. Thank you for having us here today. My name is Janice Donlon and I am the Project Manager for Funded Services with the HSE Sexual Health and Crisis Pregnancy Programme. And I'm joined today by Helen Deely, who's the head of the programme. We've been asked to address the committee in relation to the supports provided by the HSE Sexual Health and Crisis Pregnancy Programme on the use of the abortion pill and on our programme. The information here will be presented in 2 sections. Firstly, I will outline supports provided by the programme to those experiencing a crisis pregnancy. I will then talk to you about some behavioural trends and research relating to crisis pregnancy, including use of the abortion pill. So the HSE Sexual Health and Crisis Pregnancy Programme is a national programme situated within the Health and Wellbeing Division of the Health Service Executive. The programme is mandated by a statutory instrument to reduce the number of crisis pregnancies and to provide support to those who have a crisis pregnancy. Legislation defines crisis pregnancy as a pregnancy which is neither planned nor desired by the woman concerned and which represents a personal crisis for her. The programme also understands this definition to include experiences of those women for whom a planned or desired pregnancy develops into a crisis over time due to a change in circumstances. A pregnancy may be considered a crisis for a number of reasons. Crisis pregnancy can be related to a perceived inability to cope with a child at that time, being too young or too old, not being in a financial position to support a child, the potential impact that becoming a parent at that point might have on their education, training or employment. And research finds that approximately 1/3 of women who have been pregnant and 1/5 of men who have experienced a pregnancy in their lifetime have experienced a crisis pregnancy. If we look now at the state-funded services supporting women experiencing a crisis pregnancy, the programme funds 15 individual crisis pregnancy counselling services who operate out of 40+ locations nationwide to provide free crisis pregnancy counselling. And details of these crisis pregnancy counselling services can be found on positiveoptions.ie. Crisis pregnancy counselling and the provision of information on all 3 options, parenting, adoption and abortion, is provided under the legal framework of the Regulation of Information Services Outside of the State for Termination of Pregnancies Act 1995, also known as the Abortion Information Act. The Act sets out how information about legal abortion services outside Ireland may be given to individuals or groups in Ireland. Crisis pregnancy counselling services are funded by the HSE under detailed governance arrangements and underpinned by a quality framework, including access to supervision and training supports and guidelines protocols to support services and their staff working in this complex area. Counselling for a woman is about creating a space to allow her to discuss and reflect on her crisis pregnancy and to support her through the decision-making process. While many women experiencing a crisis pregnancy resolve the crisis for themselves or have support from family and friends, research finds that they see a clear role for a counsellor. The importance of a supportive listener and non-judgmental support allows them to consider how the pregnancy impacts on their lives. It is the counsellor's role to provide space and time to facilitate women to work through difficult conflicts in a non-judgmental and non-directive manner. During the counselling session, the client may request information on the options that are available to her. If we look at parenting, any woman considering parenting a child will be made aware of the various organisations and community support groups that offer information and support in relation to parenting, either alone or as a couple. Many of these organisations are also funded through the programme. Such organisations and groups have detailed user-friendly booklets touching on many issues of parenting, including information on rights and entitlements and accessing support services. If we look at adoption, crisis pregnancy counsellors are able to provide a client with some of the basic principles surrounding the process of adoption and the rights of birth parents and adoptive parents. However, if a woman chooses adoption as an option, she will be appropriately counselled and advised on all stages of the adoption process by an adoption social worker, either with a TUSLA adoption service or an accredited body. If we look at abortion now, if after appropriate counselling on all options a woman makes the decision to terminate her pregnancy, she should be given as much information as is necessary. Information about abortion services in other countries may be made available under certain conditions. The law on this subject was passed in 1995 and is usually known as the Abortion Information Act. The Act sets out again how information about legal abortion services outside of Ireland may be given to individuals. Information on how to access abortion services, including the names and addresses of clinics, can be provided, as can information on the types of procedure that may be available to her. Crisis pregnancy counsellors are not medically trained, and any specific medical questions are referred to the woman's GP. All information should be provided in a manner that is accurate, unbiased, impartial, and in accordance with the law. This is necessary to allow the woman to make an informed decision as to the most appropriate course of action for her. Information may be given in different formats, including written material, which the client can take home with her. If we look now at the numbers of women that attend crisis pregnancy counselling services, the numbers have fallen significantly in the last number of years. If we look at in 2010, 4,662 individual clients attended for crisis pregnancy counselling, and by 2016 that number had fallen to 2,570. The majority of women attending crisis pregnancy counselling are between the ages of 25 to 34. It is recognised by ourselves and by the services that in the 20 years since the commencement of the Abortion Information Act, there has been many developments in technology, including access to the internet. Many women are now bypassing crisis pregnancy counselling services and accessing information on abortion services directly from the internet. While the numbers attending services are decreasing, counselling services report that those attending services are presenting with more complex and multiple issues. The challenge for the programme and the counselling services is to ensure that women in most need of crisis pregnancy services and supports feel that their services are relevant to them and will meet their needs. Many of the counselling services funded by the programme also support women and their partners through the diagnosis of a fatal fetal abnormality or life-limiting condition. Additional training and support has been provided to these services to ensure they are able to respond to the needs of this client group. Counselling services have forged links with maternity units and have the expertise and the capacity to support women and their partners through this difficult time. Just a note on some crisis pregnancy agencies which are not funded by the state. Some organisations that advertise as crisis pregnancy counselling services have a hidden agenda. The service they provide is designed to influence the choice a woman makes and to pressure a woman into doing something she may not want to do. Once these agencies have been contacted by a client, they can seek to delay the counselling process and in certain cases show clients inappropriate images or use other tactics in an effort to influence their decision. These organisations are not state funded and women are advised to find out as much information as possible about a pregnancy service before they make an appointment. All HSE Sexual Health and Crisis Pregnancy Programme funded services are advertised on positiveoptions.ie and will provide non-directive, non-judgmental counselling. If we look now at the post-abortion services that are available, post-abortion counselling is provided by the same funded services which provide crisis pregnancy counselling, and details of these post-abortion counselling providers are available on abortionaftercare.ie. Information on the availability of free post-abortion counselling in Ireland is also provided by abortion clinics in the UK and in the Netherlands. The programme links with abortion providers to ensure the information is made available to women who have travelled from Ireland. Post-abortion psychological support allows a woman a safe space in which to explore and articulate her feelings, whatever they may be, towards the decision made and perhaps the experience of the abortion itself. A client may require a number of counselling sessions post-abortion, and the counsellor is available to support the woman depending on her individual needs. A woman may attend for post-abortion counselling shortly after her abortion, or she may attend at a later stage if issues emerge related to other life events. The number of women who access post-abortion counselling has remained steady over the last number of years, and in 2016, 1,377 clients were seen. If we look now at a post-abortion medical check-up is also available for women to ensure they've fully recovered from their procedure. A check-up normally involves a blood pressure check and an examination of their abdomen, and the doctor will confirm that the pregnancy has ended, check that the bleeding pattern is normal and there's no infection, and assist the client with her contraception needs. A number of the services funded to provide crisis pregnancy and post-abortion counselling also provide free post-abortion medical checkups, and the details of these again are available on abortionaftercare.ie. Attendance at the medical checkup also allows an opportunity for the doctor to refer the woman to post-abortion counselling if such a referral appears beneficial. The numbers attending these services is low. In 2016, 442 women attended medical checkups funded by the programme. Women may also attend their GP on return if required, or depending on the type of procedure they have undergone, they may not require a post-abortion medical checkup, for example, early medical abortion. So now we're just going to look at the behavioural trends and the research relating to crisis pregnancy, including the use of the abortion pill. As a core function of its work, the programme monitors behavioural trends relating to its mandates, using a range of tools and indicators, including general population surveys and statistics. Research informs us that crisis pregnancies happen to women and their partners from all different ages, socio-economic backgrounds, and with different relationship statuses. The majority are married, engaged, or in steady relationships when the crisis pregnancy occurs. The most common reasons why the pregnancy is seen as a crisis is because it wasn't planned, or the woman and her partner consider themselves too young. The average age at which a crisis pregnancy occurs is stable at 24 years for women and 25 years for men. If we look now at the outcomes following a crisis pregnancy, we can see that parenting is by far the most common outcome for those experiencing a crisis pregnancy. A survey of the general population found that when asked about their most recent crisis pregnancy, 73% of women reported that they chose to parent. In the same general population survey, 2% of those asked about their most recent crisis pregnancy reported they chose adoption. Traditionally in Ireland, adoption was a common response for women experiencing a crisis pregnancy. However, the number of women placing their babies for adoption has decreased significantly in recent decades. 24% of women in the same general population survey who reported an experience of a crisis pregnancy reported that they chose to have an abortion following their most recent crisis pregnancy. If we look now at abortions in other jurisdictions, it is well documented that many women travel from Ireland to other countries to access legal abortion services. The programme analyses data collated by the Department of Health in the UK and the Ministry of Health in the Netherlands on the number of women travelling to those countries from Ireland for an abortion on an annual basis. In the majority of cases, women travelling from Ireland for an abortion travel to England. In 2016, 3,265 women gave Irish addresses at UK abortion services, representing a rate of 3.2 per thousand women. There has been a gradual decline in the number of women availing of abortion services in the UK since 2001. In that year, there was 6,673 abortions to women from Ireland in UK abortion clinics, representing a rate of 7.5 per thousand women. If we look now at the Netherlands, the Ministry of Health in the Netherlands has collated data on women providing Irish addresses in Dutch abortion clinics since 2010. Prior to 2010, the programme linked directly with the main abortion service providers in the Netherlands to establish the number of women providing Irish addresses there. In 2015, 34 women were recorded to have provided Irish addresses in abortion clinics in the Netherlands. These figures have significantly declined since their peak in 2006, when the number was 461. The Netherlands has emerged as the only other jurisdiction to which women from Ireland have been travelling for abortion procedures in any significant numbers. If we look now at the number of abortions in Ireland under the Protection of Life Act, the Protection of Life during Pregnancy Act 2013 defines the circumstances within which abortion in Ireland can be legally performed. The total number of abortions carried out in accordance with this Act in 2016 was 25. There were 26 in each of the years 2014 and 2015, and 2014 was the first year in which the data was reported. If we look at the issue of abortion pills now, abortion pills are designed to induce an abortion for a woman who is less than 9 weeks pregnant. Abortion pills are used by abortion providers in medically supervised clinics in countries where abortion is legal. These are referred to as medical abortions. The programme is aware that some women are accessing abortion pills in Ireland from international online providers. In order to try and understand the incidence of this, the programme set up a reporting relationship with the Health Products Regulatory Authority in relation to the number of abortion pills seized by custom officers annually. The programme has provided training and support to all funded services on this emerging issue. All services have developed protocols in this area, and training manuals and online resources have been updated with relevant information. The reasons women may be accessing abortion pills online are cost and access. For women who have made the decision to terminate a pregnancy, the cost associated with travelling from Ireland to another country for a medically supervised termination is high. Research finds that higher earning women are more likely to travel to other countries for abortions over their lower earning counterparts. Until recently, it was difficult to make an assessment of the level to which this practice is occurring, as limited information was available. However, recently published research suggests that more women are contacting online providers of abortion pills annually and becoming more aware about the availability of these drugs online. As you have been informed by a previous witness, Dr. Abigail Aiken, her study found that over the period January 2010 to December 2016, the number of women from Ireland contacting an online provider of abortion pills tripled. In 2010, there were 548 online consultations completed by women from the island of Ireland. In 2016, the number had increased to 1,748. Another research article published by the same authors in 2017 reports on the experiences of women following taking the abortion pill in Ireland. The study reports on 1,000 women who underwent self-sourced medical abortion from the online service. The study reports that while the vast majority of women did not need to contact medical services following taking the abortion pill at home, approximately 1 in 10, 9.3%, reported to the online provider that they were experiencing a symptom for which they were advised to seek medical advice, and the vast majority of these women sought medical advice as advised. The programme has identified one other main provider of the abortion pill and has sought similar information from this provider for a more accurate assessment of the trend. If a woman takes the abortion pill and has prolonged bleeding, bad pain, fainting or other complications, we would strongly encourage that she attends an emergency department or a GP straight away. Or if a woman is concerned about her health following taking an abortion pill, we would encourage her to attend a free post-abortion medical check-up funded by the HSE. And again, a list of these services is available on abortionaftercare.ie. So I'd like to thank you for your attention, and Helen and I are happy to take